We shall now move on to the orations of our very renowned surgeon. I would like to invite Dr. N.I. Hebsur sir, Dr. Chandrasekhar N sir, Dr. Rajgopal Chenoy sir, Dr. B.N. Patel sir to kindly chair the session. I would like to invite Dr. Sriram Bhatt sir to kindly confer Professor M.P. Pai oration on the art of communication in current day practice begs for a change.
This is a small introduction to Dr. Sriram Bhatt, being son of high school teacher late Mr. Krishna Bhatt and late Mrs. Devaki, hailing from small village in Dakshina Kannada. Initial education at Sulya Government Junior College. Later did MBBS from Kasturba Medical College, Mangalore in 1986 and finished MS General Surgery from the same institution in 1990. Joined in the Department of General Surgery as faculty, became head of the department in 2018 for 5 years, currently working as professor and unit head Kasturba Medical College, Mangalore, with working hospital at Government District Wenlock Hospital, Mangalore, Dakshina Kannada. Wrote many surgical related books, SRB Manual of Surgery, SRB Clinical Methods, SRB Surgical Operations of Text and Atlas, SRB Atlas of Tissue Approximation, SRB Surgery for Dental Students, SRB Surgery for Nurses, SRB Bedside Clinics in Surgery. He has got own teaching website in YouTube, Instagram, Facebook, etc. Married to Dr. Meera Sriram, is a practicing gynecologist in Mangalore, and a daughter, Miss Ananya, is pursuing her PhD in Houston, USA, after BTech from MIT Manipal. Here is Dr. Sriram Bhatt. So please continue.
Very good morning, everybody. Thank you, Rajgopal Chennai sir. Rather, he is always give encouraging words to me. Always, we did MS together. Of course, he was senior in KMC Mangalore. I was doing final year MBBS. So I know him since that point of time. And dear chairpersons, senior faculties, teachers, my contemporaries, colleagues, young faculties and teachers, my dear postgraduates. Again, I thank Professor Rajagopal Chennai for introducing me. I also thank Dr. Rajesh Ballal, who did introduction day before yesterday about me. Oration today, I thank organizing chairman, organizing secretary, organizing team, and state chairman and secretaries for giving me opportunity to deliver oration on prestigious MP5 oration. So all of you know, we know at least MP5, Professor MP5, a great man. Full name is Mangalore Panduranga Pai. He has written a book, Mountain and Sea Autobiography, very good book. I have read this book completely. And is born in 10th April 1919. Parents, Panduranga Pai again, Krishna Bai. Only son, Sister Lalita, lost father at age of 2. And he is from Kadri, Mangalore. And he did his earlier education, Canara High School in Mangalore, Government College, Mangalore. And he did his MBBS in Stanley Medical College. Then eventually did MS in Madras Medical College. And had his FRCS also. And practiced 7 years in Coimbatore. And eventually in Vellore. Then in Assam, he was there. He's got a detailed, he has detailed about how his experience in Assam as a surgeon in a rural area. And he was honorary surgeon in Victoria Hospital. Before entering to Mangalore, there is a Kasturba Medical College, Mangalore as such. And his MP5 professor in 1954 with Madam Kamakshi, and is a contented couple with 3 children, all doctors settled in abroad. A renowned teacher, excellent academician, great surgeon, extraordinary human being is Professor MP5. He was BC Roy National Awardee, and he has met Srimati Indira Gandhi, and he is elected to MCA, Executive Council next year also, remained in the post till retirement. He established first PG department in 1962. Responsible for construction of college building, what is existing today, and also forced management to get Attavara land actually for further development, and he was principal of the college till his retirement. And he's the first one to start MS in Karnataka. I think in Karnataka, first MS course started in KMC Bangalore by him, and it's organized annual conference also in 1966-67, and he had established Burns ward in Kasturba Hospital. And post-retirement, he was in Oman for 6 years, later in SCS Hospital in Mangalore, and he was very much interested in the Vidyabhan cultural place. And my connection to Professor M.P. Pai, he was retired when I joined post-graduation in Mangalore, KMC Mangalore. But I used to meet him in SCS Hospital. So every time when I meet him, he used to give some suggestions and used to give encouraging words. He has got separate chamber there. So we used to meet him there and speak to him. And his students, Professor C.R. Ballard, Dr. Jaram Shan and Ashok Pandit, probably they are my mentors. I was supposed to graduate under Professor C.R. Ballard and worked under him in his unit for lengthy, more than 7 years. His clinical sense, great rounds and analysis, probably teaching ability, which I have learned from him. And Professor Jaram Shane, a skilled, courageous surgeon, so skill, courage, and decision-making and analysis, and in-depth pathological assessment of different cases, which I have worked under him for more than 7 years. Probably I have learned from him. And my good friend, senior urologist, Dr. Ashok Pandit from Enapaya Specialty Hospital, we work together. We have been working together for the last 30 years. He taught me laparoscopy. He taught lot of skills. We do surgeries together, all open surgeries, and lot of skills. Much more than that, ultimate dedication and undue hard work, which probably I acquired from him without any doubt. And these three are definitely my mentors for my current surgical career. And we had MP by centennial celebration on 10th April 2019. So these are the different photos, although all his students were there during that time. And so dedicated to Professor M.P. Pai and all my teachers, so whoever taught me in different levels, different stages. The topic is, which is very, very important currently, not just this discussion or recent advance or whatever it is, which is a very need of the day because of the high tech. We are rather losing communication with the patient, which is very much a requirement. So art of communication, current day practice begs for a changeover. So art of communication is the language of leadership. So if you don't able to communicate, your leadership capacity will be not in optimum phase. That's what James Hume told. In olden days, of course, all of you know, doctors were considered when you were small. Doctors are God or demigod. We don't question them. We don't ask any questions. Whatever they do, it is ultimate, final. So they also don't like you, patient to be asked. But the current day it is not so. But what is changing it is, so types of patients we get: ignorant, informed, empowered, enlightened. Now look at this. First two patients are, rather they listen to you whatever you say. They are not bothered. They don't question at all. Like I got two set of patients. One I work in district Wenlock hospital in the last 35 years. And patients come from different parts of the country, come from the state actually, neighboring districts like Hassan, Chitradurga, Saurabh. These patients get in, listen whatever you say, never question us. When they get cured, they go with the happy mood. I think sir knows that. And they are ignorant and informed, easy to tackle. We are also happy with that. But in private setup, it is not so. Trend is totally different. They are empowered, enlightened. They seek answers for every work you do, every level, whatever you are doing. You need to answer them. That is the problem. We need to have a proper communication in the last two category patients. So types of doctors, I am God and God-like, but really only in olden days. Current senior, it is not so. Purely only professional gives options, and professional and decisive. Probably last one is is the current trend. Last two, depending on the individual situations, surgeons may get divided between the last two. Hurdles are for obtaining degree for postgraduate MS, super specialty, uh, license to practice, and learning art of treating. That's also once you finish MS, problem begins actually. Because you have to learn skill, you have to treat patient, you have to get to patients. That is the best, that is the only asset for us. So everything is a tedious job until you get settled. So art of treating it is called as, it comes after MS actually. And we are always for patient, and that's how exactly we have taken this profession. After taking this profession, we understand that there are problems. We keep on telling this is that, this is that. But once you have jumped into this profession, you have to sail through this. We can't say I'm not coming up. So we need to go through that. Of course, we have to find some solution. So we should accept these things. We should hug these whatever problems and sail through. And we have compulsion to maintain good relationship with the patient. That's important. So without proper relationship, to proper communication, so we need a proper real CPR to relation, that the relation to the patient. Of course, relation to other faculties also many times. For overall hospital environment requires a real CPR. And today, basic thing is we are not happy with the patients. Patients are not happy with us. So this trend should be changed. We should have a cordial relation. So communication is the most important way. So what is communication? It's a science as well as an art. So it is consciously communicating with the another person at their frequency, not ours. My frequency of teaching is, talking is different. But you look at them, moment patient comes to your clinic, we see regularly 20 to 30 patients last 30 years. Moment they enter your clinic, we'll immediately look at their body language, their approach, and I immediately will make out what type of personality he is. So accordingly, start speaking to them and start speaking at their frequency, not at your frequency. That's the best way to get them into your conscience. So patient will never care how much you know until they know how much you care. The care which you give much more important than what you know, what you say, your degree. All those things are secondary, at least in this country. 90% of currently 90% public opinion, they say doctors won't communicate properly. It's the current trend actually. And this is especially, I'm sorry to say that, in a high-tech hospital, because all initial communications are done by probably different levels of people, not by the consultant. What patients expect is direct involvement of the consultant, which especially in the major towns, major cities, metropolitan cities, which is not happening. But still in small towns, small cities, consultant directly speak to them, but patients expect consultant to speak. Whoever you appoint, reception, whatever it is, that is not going to help. That's what things have changed, but these things have changed and that are lost the public opinion. And don't look at the patient as a test material or a commercial component. Look at him as a human being first who needs our care and treatment. The moment they come, will ask them what insurance you are having, how much money you are having. First discuss what is the disease is, then discuss about the budget, whatever it is. So directly after many patients have come and they are telling, first asking for money, first asking for insurance. They are not bothered about my disease as such. So there is a many times patients complaint about such high-tech hospitals. And 5 E's are important: engage, empathy, educate, enlist, expectations. Engage the agenda, join the patient, welcome and introduce, always give some chair or ask them to ask, give them privacy to speak actually. And elicit agenda, set the agenda. Don't, because moment patient comes to your clinic, if you keep on speaking to somebody in your mobile phone, they'll wait for a minute or two, then get frustrated. So always I put my mobile off or give my mobile to receptionist rather than engaging unnecessarily with the mobile as such. And create psychological safe setting to the patient and educate the patient, assess the patient understanding capacity. The moment they come, you can assess daily. In the last 30, 35 years, when you see the patient, we know the body language of the patient so easily. You can understand, assume questions, what they ask, and accept the feelings of the patient and expectations. Empathy is a compassion, have compassion, understand the psychology of the patient and relatives, communicate clearly and precisely. Don't use loose words, casual words, because you are a professional. You should have a very dignified words when you speak to the patient. This is very, very important because way we assess the patients assess us. It's a mutual. They assess you how you speak, what you speak, how dignified you are. So that is very, very important how you communicate. Never use loose talks, jokes, because they have come for some illness. That is definitely a serious business. So there is no scope for loose talks or jokes when you communicate with the patient. So communication, when, what, how. So when all you need to communicate, first when you come to the patient, you should communicate. What I do is ask them to sit, uh, speak to them somewhere, you have come, name everything. Then start discussing with them what exactly happening. Then give some time to the patient. They want to tell so many things. Give some time to start them to speak. Then in between you can brief, little bit interrupt and take whatever their words to your requirement. What exactly history you want, you can later divert and take the extract whatever history which you want, because history is the most important in all these patients. And then always examine. Sometimes may come with the report. You see the report, you know what is happening. Because psychologically, if you don't touch the patient, because again, many times patients say, this fellow is a senior specialist, he has not touched me. He said, there is no need to examine. Don't do that. Take the patient to bed and examine the patient. They feel that something you have discovered. So clinical examination, even though many, many times you feel it is not necessary, but for patient's sake, every patient examine the patient. It's a basic requirement that relates to a lot of psychological aspect of the patient. And it is not enough if first interaction you draw diagram, everything, tell this, sometimes they come with the report. Otherwise, you have to guide them. These things are to be done. This is the probable diagnosis, everything, of course, you will explain. And once you do that, you admit the patient. Again, after admission, you have to go to the hospital, see, again to discuss what is happening, what you are going to do. And when you do a procedure, all patients, when I operate, before going to the OT room, I go and speak to the patient party and enter the OT. And moment I finish the surgery, I come out. If there's a specimen, I myself take the specimen and show to the patient and discuss and tell them, draw the diagram and tell, this is what exactly I have done. There are so many other problems, whatever things, whatever changed findings on table, I will call them and tell this is the changed finding. I may have to alter the procedure. So we have to follow this one uh, professionally, very clearly, and should make it standardized. So if you follow this one, start doing this one, it becomes automatic. Moment, if I don't speak to the patient, I become very restless before starting the surgery. Even after surgery, I definitely always speak, make a point that I'll speak to the patient and go, however busy I am. That is the requirement before and after procedure. And any changes in therapeutic strategy, I've told you need to inform them about response of therapy during discharge, when to come, where to come. It takes only few minutes to tell that. It is we ourselves you tell, they really appreciate. These are things you have to cultivate on our own by repetitive uh, practice actually. What to communicate, what patient already knows, you tell, you know this one, this is what you are going to do. What patient wants to know further. So if you have done a surgery, malignancy, whatever it is, eventually you tell you need to have adjuvant therapy, that is everything. And sometimes we want to know something, history or something from the patient. So you also ask the patient what I want as far as better management of the patient. So these are things you have to communicate. And how to communicate, sit and talk. Don't be in a hurry. Ask the name and relation. Make your communication very comfortable. Draw diagrams and illustrations and explain. And briefly tell of the disease, surgeries, its consequences. You need to tell, there's a legal point, but tell it in a proper way. Most important thing in communication is the hearing about what is not said. So if patient wants to tell something, no, I'm busy, I won't tell my assistant, just to stand for a few seconds. They tell what they want to express. Please make sure that however senior you are, finally they are patients. You need to, your age is not a question. Maybe you are young, maybe very senior. You need to follow this one. You speak to them. That will be definitely appreciated. More senior you are, you do that, they'll be appreciated better. And tell the need for transfusions, anesthesia, ICU care, because major surgery naturally tend to go for ICU care. Sometimes problems will be there. So all those things should be explained. Cost also sometimes explained. And now many times in major cases, we do video recording of our conversation because of the legal issues. And document what you have spoken. That's important. Write in a paper or at least record it. And always try to communicate the same. That's the main problem. You do surgery, today brother will be there. Next day uncle will come. But first day when you admit the patient, tell him what's your name, ask his name. Remember his name, find out the relation and tell I'm going to communicate with you only. Unless there is essential, some other person I'm not going to come. Make your point very clearly but politely. Don't be aggressive with the patient anytime. And otherwise, every day some other person will come, they will call you, they will ask some other question. So tell one person I'm going to communicate. So that will unnecessary avoid your repetitive explanation to different relatives of the patient. And beware that your communication may get recorded without your knowledge, both in the ward, in the room, in the clinic. Many times they record without your knowledge. They put their record on and they discuss. So your words should be very, very careful, very, very professional. You don't know who will record, will not record. And that may be, they will say, they make it viral, and then a lot of nuisance, unnecessary, you will have a stress. And listen to the patient, be patient with the patient. Alert is the current trend which is there in all online. This one, acknowledge, listen, explain, review, and thank the patient. Care for patient satisfaction. Alert approach, same acknowledge, shake hands, good greeting. Should feel that you are concerned. We have to show some concern to the patient. Otherwise, because they have come for some treatment, they are ill. They are not come for marketing or whatever it is. It's a disease brought them to you. That point is, you should be very, very clear. Explain properly with the confident, review and revise. Sometimes you have to tell because this one, we may have to take a second opinion. Tell them, we have got a further experts, we are going to take opinion from them. Don't be egoistic. Whatever required from the patient point of view, patient benefit, we should express. And class approach is another thing. Contest, listening, acknowledge, strategy, summary, and touch. It is the best non-verbal communication. If they are really worried, touch them. Now again important, touch only neutral areas of the body. Here hand, forearm and head. There are three neutral areas of the person that can be touched. So that's the point is very important, is neutral area to touch. If you touch them, then they'll feel somebody is consoling, showing some compassion for us. So that's also important. And with the situation charge, address emotion first, then the real issue. So console them, address emotion, but then real issue also should be addressed. Address crying of the patient, explore it, don't ignore it. Move closer, touch, give a pause, your discussion, empathize. So all these things are important. Slowly, eventually you practice, you concentrate on this communication method, then eventually you will acquire it and becomes natural to you. And balance your ego with the patient's ego. Especially, don't tell the patient that I am only doing this surgery. You tell everyone else surgeons are doing the same procedure. Nobody else, other surgeon is doing not good surgery. Don't tell that. Ego is dangerous to surgeons. I am the only person doing, I'm only the best. Everybody is the best at their own contest. That point every surgeon has to remember. Otherwise, someday it will cause trouble to you. And this is the most worried thing currently. We have got Google doctors. So before they come to you, they Google about you, your everything they will have in their mobile. And also they'll Google about the disease, half knowledge or poor knowledge about the disease, but they discuss about that. So they are major competitors, but they are not licensed. They are available 365 days. And they are not a real doctor. That's important thing. So they Google something and they know everything they Google and tell this is what exactly happened. But in an individual patient, things are different. You tell that individual patients are different. Disease behaves separately. Your approach is different and it is more analytical. And miscommunication is the cause of dispute and anger. So you don't communicate properly, then they'll get anger. And as the desire, their desire, expectation, aspirations about the patient, they think that in a major disease, they come, they think that we are going to cure them. Then you tell that, you assure once, then you can't withdraw that. Tell them, this is like this is may not be able to manage properly. So we should communicate properly. Don't give wrong information. Don't give that this is the major disease. I'm going to cure it. I'll give 100% cure. So wrong assurance should not be given. That eventually definitely trouble you. Explain, reason out, review, and rediscuss, and take second opinion without ego. Seek help when it is a problematic, especially on table. Of course, in Mangalore, we have got enough teachers and around. They come whenever we call for any difficult procedures on table. So that will really help us. And definitely, we tell the patient party, I have taken the help from so and so because I was finding it difficult. Don't be egoistic. Inform the patient. There was some difficulty. I called somebody else. Finally, patients are the priority, not yourself. And never use abusive language. It's very, very important. We have a patient. Sometimes patient use abusive language. Be quiet. Never abuse other doctors. That all of you know, we should not do that. What they have done when you are not there, you can't give an explanation. You better tell like that. You are not knowing what they have done. So that is correct or that is wrong. Should not explain that. What is current problem? That is the only thing I can explain. I can't give a judgment for others' treatment strategy, whatever it is. So don't be judgmental without knowing backup knowledge. And allied fields also, I tell about physician, they are wrong. We can tell within ourselves, but don't tell with the patient. Always maintain calmness. Don't get angry. And inform critical nature and death. Be polite but affirmative. Inform the cause very clearly, but we should be very, very clear. This is problem. This is definitely danger. Probably he will not survive. He is critical. But politely you tell that, but never create situation that it is mistake. Again, don't tell that it is your mistake. It is happening. Happenings are different. Mistake is different. Mistake is negligence. Happening is natural course of the disease. So this difference, while explaining to the patient, you should be very clear. Respect emotion of the patient and party with empathy, but let us not be emotional. We cannot be emotional with the patient party, but we will be polite and affirmative. There's a point which you have to remember always. Bad news is anything that changes the patient's view of his or her future. There is a real gap between expectation of the patient and reality. Reality is unacceptable and unpalatable. These are the things I'm not going to detail it. Setting, perception, invitation, knowledge, explore, strategy, summary, and consoling and compassion. This is again most important. Documentation. I've been telling my PGs, date, time, follow-up. That's very, very important. So many times I shouted the PGs, write follow-up daily. OT notes then and there only. OT book writing then and there only. Sometimes they'll write after 2 weeks, something so like that. Don't allow that. Write your notes that day, that point of time only. That is the most important thing. Legally, very, very important. And all of you have seen this undisputed 3, whereas Boyka in the last final fight, he says, improve, adapt, overcome. Improve your knowledge, adopt for the new setting, overcome your negative points. That's how you face these challenges in your professional career. And surgeon, a dying general surgeon, a dying breed. I just run through these slides. Surgeons are interns who operate. Wisdom comes all through the suffering. That's why I said it takes a lot of time to get your wisdom to carry over with the proper professional treatment with the patient. And Guido Lanfranchi, he has told we should have very much skill. We should have best communication also with the patient. He told this one long ago. This is his quotation. I'm going to read this. That's what exactly it meant. And use of clinical knowledge, technical skills, common experience of dealing with a variety of people on daily basis makes surgery feel that is not only challenging and satisfying, but fun. And Zachary Cope, all of you know that he has written a book 80 years back, Quotations in Surgery, beautiful quotations with a small, around 80, 100 pages book. He told 70 years back, clinical method may slowly go off. He said, use 2 little hand, ear and eye. So he foreseen the problem or clinical assessment will go off 80 years back, who has written a quotations on the surgery. And surgery is he told surgery is a culture, it's a judgment, it's a principle. It needs a courage and discipline. It's like a military. Learning surgery is like a military. Need to be disciplined. That's a basic requirement. Otherwise, you won't learn surgery. And Joseph Lister, father of aseptic surgery, he has told that if you love the surgery, that is the most important thing. And proud to be a surgeon, proud to be a general surgeon also. One incident I want to tell. Now all of you know that in institutions, especially in surgery department, after 2-3 years SRship, they go for super specialty. Same was good for our institution also. Some 2 years back, one of the SR got MCS seat in so and so good hospital. And 2 days after joining, he called me and told, sir, our MCH head told, I will undo whatever general surgery you have learnt. I request all these senior people, so-called super specialists, don't put such loose talks. That is not acceptable. He felt so bad, sir, what you have learned is wrong, he has told. You can always tell there is some modification you have to do, whatever you learned, we'll change this one. Such a gross, loose talks, being a unit head, being head of the department in a super specialist, putting loose talks about general surgeons is definitely not acceptable. Whoever it is, seniors, behave dignified way and also articulate your words meticulously and properly, especially when you speak to juniors, postgraduates, and other consultants. That's very, very important. And we are the generals of the surgery. That is important thing. And you know that actors and surgeons, all the heroes of the moment, you are here, and after 10 years, they may remember you. After next generation will forget it. There are exceptions. Charlie Chaplin is ever remembered. Mr. Bean may be ever remembered. Every one of us cannot be Charlie Chaplin or Mr. Bean. So we'll get erased off eventually in due course of time. So people who change after change will survive. People who change with the change will succeed. Of course, people who cause the change will lead. So request all junior faculty, youngsters, be leaders, be a leadership, acquire leadership, cause the change, will become leaders. So innovation is the very, very important in the future profession as such. That is for youngsters. And keep the patient happy. We also should be happy. It is our social responsibility. Once you have joined this profession, it is our responsibility and commitment. You can't keep on telling that this is wrong, that is wrong. Keep on, don't express your frustration. I have jumped in this profession. I have to sail through whatever problem it is. It is our commitment, our responsibility to the society actually. That is important thing. This is what Sholay picture. Next one, play. It is the 42nd, this one. It's the first song in the Sholay. Voice is there, voice. No problem. Voice is not coming. So, doctor-patient relationship cordial and let it be understandable like this. And that is the website which I am having, and daily lectures, 10 minutes about surgery, instruments, specimens, case discussions, operative procedures. Daily it is there in my website. All students can subscribe, it's free, and make it. And once in 2 weeks, live session, case discussion for undergraduates, I'm doing regularly. So with this, I thank you for patient listening. Thank you very much for chairperson and everybody. Thank you.
Sir, excellent talk. It was very enlightening to all of us. You spoke about all the levels of doctors, teachers, students, and patients. We have to communicate. Communication is the most important tool for all of us in everyday life. The human touch, what we need to keep in our minds and do things. You have enlightened it so well. Thank you so much. Can we have a big round of applause for sir, please? Thank you so much, sir.
Thank you so much, sir, for this very detailed and inspirational talk.